So, you guys, this is how we're actually going to do some of class and some of homework. So, we're going to talk about understanding the healthcare facilities and organizational structure with a focus on long-term care facilities. LTC stands for long-term care facilities. So, where do you actually think a nurse aide would work? Because this is answering your question. So nurse aides can work in lots of settings. They can work in clinics, they can work in hospitals, they can work in rehabilitation centers, homes for the aged, which is elderly care, home care in someone's home, a long-term care facility, as well as psychiatric facilities. So hospitals provide care for individuals of all ages with a broad range of health problems. Services vary and they can be extensive or less extensive, and they are services such as diagnostic services, therapeutic services, medical surgical services, as well as emergency services. So let's talk about Health Science 2. What does diagnostic mean? So diagnostic is something pertaining to the identification of a medical condition or a disease that is determined by a physician. Physicians can diagnose, nurses cannot. And that is actually a statement of what is wrong with a resident or a patient. So diagnostic means to diagnose. So what does therapeutic mean? Therapeutic means to fix, to treat, or correct a problem that is medical or surgical. For example, the patient may be diagnosed with hypertension, which means elevation of blood pressure. The therapy may be medication, which is aimed at treating, fixing, or correcting that medical problem of hypertension. Okay? So what does medical mean? Medical means pertaining to the science of treatment that includes drugs, medications, diet, exercise, and other non-surgical intervention or means. Surgery is the treatment of an injury, a deformity, which means something that is abnormal, and disease by manual and instrumental operations. That means you go into the emergency room with abdominal pain. They find out that you have appendicitis and they need to remove your appendix. That is a surgical procedure done with an instrument. So what is an emergency? So an emergency is sudden occurrence of a serious and urgent nature that demands immediate attention. Therefore means it could potentially be life-threatening. So let me give you two examples. You wake up in the middle of the night with a sore throat and difficulty swallowing. Your brother has strep throat. He saw the pediatrician 2 days ago. You drank after him. Now your throat hurts. So the opposite of that is no one is sick. You wake up in the middle of the night and you cannot swallow. Which one is the emergency? So that would be one of those situations if you go to the ER because your brother had strep throat and you woke up with a sore throat. That may not necessarily be a life-threatening emergency. It may scare you, but it may not be a life-threatening emergency. So let's talk about hospitals. There are different types of care that occurs in a hospital. Acute care, chronic care, and terminal and palliative care. So what does acute mean? Acute illness has a sudden onset from which you are expected to recover. Therapy for an acute illness is short-term. It's usually in a hospital for patients that have an acute illness or injury or recover from surgery. So let's go back to the appendix example. So you have sudden onset of abdominal pain. That is an acute illness. You're expected to recover from it. Your stay in the hospital will typically be about 2 days, maybe, and you have to have surgery to remove it, and then you go home to recover. That is an acute illness. Chronic illness has slow or gradual onset, and there is no known cure. The illness can be controlled and complications can be prevented. Chronic care is medical and nursing service that focuses on long-term care of people with chronic diseases or conditions, either in their home or in a medical facility. It includes measures specific to the problem as well as others to encourage self-care, promote health, and prevent loss of function. For example, a patient who has dementia. Dementia is a gradual onset. There is no cure, but you can actually help the patient by keeping in their home, in their familiar surroundings for as long as possible. So what is terminal? Terminal means an illness from which you are not expected to recover and you will die from it. Residents with terminal illnesses are given comfort care, which is called palliative care, versus curative care. So, for example, you are diagnosed with cancer. Stage 4 is a very bad stage of cancer. You are given the decision treatment or not to have treatment. If you choose to have treatment, you want curative care, which means you would like for them to cure you and fix you. Versus you decide, I'm not going to recover from this, therefore I am going to have palliative care, which means I want you to keep me comfortable because I know this is going to cause my death. So long-term care facilities are referred to as extended care facilities, skilled nursing care facilities, nursing homes, and continuing care retirement communities. This includes skilled nursing care. Long-term care facilities provide healthcare services for individuals unable to care for themselves, such as elderly, disabled or handicapped persons, or people with a chronic illness. Long-term care facilities provide medical care, nursing care, nutritional services, which does not always mean just a cafeteria. It means a dietitian to help make the best decisions for what you need for your disease process. For example, a diabetic does not need a diet consisting of cake, apples, pie, yogurt, but more protein-based and animal-based and plant-based foods. It also consists of recreational services and rehabilitation services. So adult care homes or homes for the aged are they've been called rest homes, and they've also been called assisted living centers. Adult care homes are multiple types. A family care home serves about 2 to 6 unrelated persons. An adult care home can serve 7 or more unrelated persons. A group home for developmental disabled adults, and multi-unit housing with services such as nursing assistants. The adult care home also assists residents with medication administration. That does not mean that there is a licensed nurse who gives the medicine. That means that you help to do it. There may be assistance with personal care, getting dressed, or with grooming, which means doing your hair, shaving, etc. They also provide 3 meals a day. Oftentimes, housekeeping is provided and 24-hour supervision. These are not always licensed individuals that are medically licensed. So homes for the aged are licensed and inspected by DHSR, which is the Department of Health Service Regulation, monitored by the adult home specialist within the county Department of Social Services, and they do most of the investigations of complaints. So home care agencies provide care in the home for people needing health services, but not necessarily a hospitalization. So for example, you have a patient who has a pneumonia and they're in their 30s or 40s and they have a supportive, loving family who can help them. The cure for pneumonia typically is antibiotics. Therefore, someone can come into the home and give antibiotics in the home. Services provided in the home care agency include nursing, which is a certified nursing assistant or a nurse, or a personal care assistant, which is a PCA, physical therapy, occupational therapy, speech therapy, social service, nutritional and food service, respiratory therapy, and someone who actually comes in and acts like a homemaker.